This is the second segment of a conversation I had with Jamie Shields, Director of Social Media for Aurora Healthcare. Today, Jamie talks more specifically about individual social media channels and how they've evolved at Aurora. He talks about how they're beginning to customize messages by market, and then he takes a look at the future and what it holds for Aurora and social media.
So, when we look at Facebook, we initially had Facebook and Twitter married together, so they were cross-posting and feeding each other. We got to a point where we decided to split those up and give them each their own focus area. Twitter we use very much for a social marketing channel. We're promoting classes and events, particular service lines. We're doing a lot to support our marketing efforts with that channel. We have 140 characters, not terribly conversational, so we use that to kind of push that information out. Facebook has really become, for us, a great area to talk about patient experience. We're doing a lot of work in there to talk about how we impact people's lives, get feedback from them on how we can do it better, providing some information about the variety of services that we offer. YouTube, another area where we're looking to really highlight patient experience, as well as thought leadership. We're a large organization, and we have a lot of experts that we want to collect content from them, position them in the field so that they can share their insights around healthcare reform, particular technology advancements for healthcare, things of that nature. So we're doing a lot of work in that space, which is interesting. And LinkedIn, for us, is a recruiting platform. That's where our HR staff spends a lot of time. So we've kind of divided the 4 platforms out so that we have focus for each of those, and we have metrics and things that allow us to measure performance, and if we're headed in the right direction, take feedback so we can adjust. So what started as kind of figuring out what each of these were, we're now in a place where we use each of them differently, and how we manage them is unique across each channel.
I've noticed a lot of hospital organizations find that most of what they do is pushing information out. They continue to use these new channels almost as if they were old channels. Are you finding that people are beginning to engage more? Are you getting into more dialogue?
That's the turning point for us through the end of 2010 and 2011. We're presenting a lot of information. The next step for us is to really truly build that community. We're starting to see that interaction, commenting and liking on Facebook, posting of certain things, same thing on Twitter. And I think there's a real opportunity for us to build that community. I think you're absolutely right, and we very purposefully got away from just referring to it as social media. Because to your point, media automatically creates that traditional framework of, impressions and reach and some more traditional marketing metrics. So we use social marketing, which for us defines more of that marketing sales push. Social communications are the storytelling, deeper interactions, and then community building is the next phase for us to roll out. So we're actually trying to change the nomenclature on how we define it, that social media is not just this new channel to do the same old things, but we're breaking it out in different frameworks so that people start to think of it a little bit differently and don't necessarily say, well, it's just another channel to do this. So we focused a lot of our social media campaigns and digital work around the brand and building those platforms, and now we're to the point where we're ready to customize by market. The move from 13 to 15 facilities is 2 new hospitals. We opened one in Summit, and Grafton opens very soon. So when you look at those 2 markets, they're distinct, and the service offerings we have are different in those 2 markets. So how are we going to engage the audiences in Grafton, for example, around the offerings that we have there? So we've just started to explore how we do that. One of the things we're really curious about is, with Facebook advertising, you can really dial down into a very specific audience. And we're looking, is that a way for us to reach out to these specific groups in these communities and bring them into a destination that meets their need? Not necessarily the brand, but targeting Grafton, how do we bring them into an environment that supports Grafton? So that's an area we've just started to scratch the surface on from a planning standpoint, but huge opportunity for us to get much more customized, because having such a big footprint, what works in Milwaukee is different than what works in Green Bay.
Are you in any smaller markets where broadband access is a problem?
When you get into our northwest areas, that's a little bit of an issue. We're doing some things. How we deliver video, we use a platform now that automatically scales. It detects connection and scales the video quality to meet. So we don't want people, we'll make the assumption you have a broadband pipe and we're going to stream this enormous, video file to you because it's high definition. We're working with ways to auto-detect connections so that we can deliver a slightly lower bit rate, still a good quality video, not HD, but you want to see the content. So we're working on ways to make sure that that gets delivered appropriately.
What do you see as the future for social media? What's next?
Customer service. It's another area where we're really just starting to get our heads around what that means using these social channels and not simply kicking these people off to a phone number or something else. They're choosing to interact with us on Twitter or Facebook. That's their choice. So we need to respect that and do our best to interact with them in that space. I think social media is a natural fit for healthcare. I think when around wellness, people like to share tips and information. Around disease conditions, cancer survivor groups. This has been something that Aurora has facilitated for years in the in-person environment. And I really think people have this natural desire to connect, especially around disease conditions and things of that nature. I think there's a huge opportunity for us to put those patients in contact with caregivers using those online tools that they may not otherwise be able to get in the offline experience. So I think there's a huge potential for us there that we've just begun to tap. So I'm really curious about community and how Aurora can support it, create it, grow it, leverage it. I just think there's real opportunity for us moving forward. We have a lot of information. We're a vast organization that has a humongous knowledge base with the thousands of physicians and medical professionals. How do we capture that and make it available for our patients or potential patients to help solve their problems, help improve their day-to-day lives? Again, don't think, oh, it's an enormous health system, and of course they have the resources and energy. It's just a couple of people who drive the social media program here. 1.25 FTEs.
Unbelievable.
Right. So it can be done with some commitment and planning. We've planned it out, and I think I would encourage, regardless of the business, with a little bit of planning, you can pull it off.